Thank you and good afternoon. Today being Monday, we're reporting on 3 periods of time between Friday and Saturday, January 22nd to 23rd. We had 408 new people test positive for COVID-19. Between Saturday and Sunday, the 23rd to the 24th, there were 473 new cases positive for COVID-19, and in the last 24 hours, 277 new cases were diagnosed. That leaves us with 1,158 people diagnosed with COVID-19 over the past weekend, 4 of whom were epidemiologically linked, bringing our total number of people who have been diagnosed with COVID-19 to 67,937 people in British Columbia. Of the new cases, 295 people live in the Vancouver Coastal Health Region, 493 people are in the Fraser Health Region, 78 people were here on Vancouver Island, 194 people were in the Interior Health Region, and 98 people live in the Northern Health Region. We now have 4,134 active cases around the province, 289 of whom are in hospital, 79 in critical care or ICU. An additional 7,242 people are under active public health monitoring, and 61,117 people have recovered. Over this past weekend, we've had an additional 21 people who have died from COVID-19 here in British Columbia, bringing the total number of people in British Columbia who have died to 1,210 people. And as always, we know how challenging a time this is to have somebody who's passed away from COVID-19 in particular, and we want to send our condolences and thoughts to the families, the caregivers, and our communities who've lost our elders and seniors for the most part across the province. We have one new healthcare outbreak at the West Side Care Residences group home, and outbreaks have now been declared over on one of the Burnaby Hospital sites and at Brookside Lodge Long-Term Care. This leaves us with 24 active outbreaks in long-term care or assisted living, 8 in acute care units, involving 801 residents and 430 staff. As you know, we are starting this month of February with a limited vaccine supply, but we hope, and we've been told, that we'll be increasing our available supply as the month progresses. Importantly, while fewer people are receiving doses this week, we are continuing with our preparations to have widespread immunizations underway on a bigger scale than we've ever done before across the province in a few short weeks. We do expect that we will receive additional Moderna vaccine later in this week, although it's slotted for coming the week of February 1st. We understand the vaccine won't itself arrive probably until Friday of this week. However, we are expecting a small amount of the Pfizer vaccine to be coming earlier than that. And since the start of our immunization program, we have immunized 138,892 people with a single dose, and 4,491 of them have received a second dose. So that is a really important part of our program, making sure that we are protecting those in our long-term care facilities as a really important key first step. I want to talk a little bit today about these variants of concern that we're seeing across the world and here in British Columbia. To date, we have had 18 cases confirmed of a variant of concern. 4 of these confirmed cases were the B1.351, which is the variant that was initially identified in South Africa. 3 of these cases were unlinked community cases, and 1 was a contact of one of these cases. In addition, we now are up to 14 confirmed cases of the B117, or the variant that has been associated with the UK. That includes 7 new cases, additional cases that were confirmed over this weekend. To give you a sense of where these cases have been, the South African variant have been all in, three in Fraser Health and three in Vancouver Coastal and one in Fraser Health. As you know, we are actively trying to determine where the people involved acquired their infections. Of the 14 confirmed cases of the UK variant, 4 of them are on Vancouver Island, 1 a traveller from the UK, and 3 additional contacts in a close household of that person, 1 in Vancouver Coastal and 1 in Interior Health, also travellers directly from the UK. 8 of the cases were identified in Fraser Health, and all of them, 7 of the 8 were travel related to various places, including through the UK, through Europe and others. And 1 was a contact of a traveller. So we have been working with our colleagues across the country, but particularly within our laboratory network here in BC, to have 3 different ways that we're looking for these variants. One is as random sampling of surveillance of cases in areas where we are seeing increased cases and growth and outbreaks. So I mentioned last week we've done some specific sampling in places like St. Paul's Hospital, where we saw rapidly growing outbreaks, in areas around where we've seen people test positive, particularly in the community cases. We are doing testing of all travelers who've come into British Columbia from international destinations who have tested positive for COVID-19, and we are targeting specific groups where we've seen in other parts of the world may be differentially affected. And we're, for example, doing whole genome sequencing of all cases in young people and school-age children. This we're doing we've done about 11,000, a little over 11,000 whole genome sequences here in British, a high percentage compared to our cases overall, and we are ramping up. Currently, we are have an ability to do about 500 whole genome sequences a day, but that is, we're looking at measures to increase that and to do, the lab is working on ways of detecting part of the genome to be able to indicate if an isolate is likely to be one that is carrying one of the variants of concern. So those, we expect to be able to step up our surveillance over the next couple of weeks to be able to do that as well. So you may have heard that today one of the contacts of a confirmed case is attended a school in the Fraser Health region, the Garibaldi Secondary School. And because we don't know a lot about these variants, but we have concern that they may spread more easily than we are seeing with other strains of this virus. We have now worked with Fraser Health and the laboratory in Fraser Health to do testing on all of the cohort that was with that person in the school. So that's about just under 80 people. And they will be tested with our rapid tests, which are good for screening and being able to test on site, but also will be tested using PCR, because we know that the rapid tests can miss positive cases that are asymptomatic in particular. So that is undergoing today over the next few days, and will give us a better understanding if there's any ongoing risk from this potential exposure event. So this is one of the things that is most concerning for us right now, that we've seen in other parts of the world and here in Canada. Reports on the weekend from colleagues in Ontario and in particular have shown that we are seeing some transmission in communities of this variant, and there's been a number of outbreaks in long-term care homes in Ontario that have been associated particularly with the UK, the B117 variant. So we have stepped up our surveillance. We are monitoring and testing in outbreaks particularly, and we'll present more data about how we're doing that surveillance later this week on Friday morning as well. But just to know that this is one of the things that is factoring in to all of the decisions that we have to make together over this next coming weeks. We have vaccine, but but it's coming in small amounts, and we've been in a little bit of a pause because of vaccine supply. There are other vaccines that are currently being evaluated by Health Canada, and we're hopeful that many of them may become available for use in the coming weeks. But right now, it's important for us to maintain our precautions that we have in place so that we're not transmitting widely in our communities until we can get a better sense of where these variants are, how they're spreading, and protect each other from them. This also reminds us that gatherings of any size in our homes or elsewhere are very high risk right now and should not be happening. We know that over the last few weeks, we have seen a decrease in young people, school-age children, in rates in school-age children, and in older people as we've been able to protect our most vulnerable. But we have seen an increase in people in the 19 to 40-year age group for a variety of reasons, some of them related to workplace exposures, but many related to social exposures. We know this coming weekend is the Super Bowl weekend, and the following is both Lunar New Year and Family Day. And then, of course, we have spring break that's coming later in this month and into March. These are occasions when we would normally take some time away or get together with friends and family in our homes, at restaurants or bars, or elsewhere. Like the December holidays, this year we do need to celebrate safely. We have light on our horizon, but we are not there yet. The vast majority of people in BC know this and have clearly demonstrated. Then when you know what to do and you do the right thing. We know this past weekend, WorkSafeBC was working with Vancouver Coastal Health, with our public health inspectors, to enforce the rules and regulations to try and get a handle on some of the areas where we have been seeing surges. And we know, particularly this past weekend, they spent a lot of time in Whistler and a few other areas making sure that people understood what the restrictions were and why. And what I heard from these reports is that in many cases there were very good plans put in place, but later in the evening people were coming together in a restaurant that might have the seating and might have the spacing and might have everything done right, but it was very difficult for the owners, for the staff who worked there, to keep people from congregating. And we know that that's where this virus can be transmitted. And we've seen that in Whistler and in other communities around the province. We will be providing an update on Friday about the orders, but I am calling on everybody right now, hold off on the Super Bowl celebrations this year. You should not be planning, whether it's at home, in a bar, a restaurant, viewings of the Super Bowl. If we are not able to control this and start seeing spread again, we can undo all the good work that we have done. We need to respect the staff and not put them at risk. Stay small, stay apart, keeping everyone safe so that we can keep our bars, our restaurants, our retail spaces, our workplaces open. And this applies to everyone in British Columbia and anyone who's considering coming here to our province. Every new day and every new week, we have an opportunity for us to keep this going and break the chain. Whether it's out for a day skiing at your local mountain, what you do at work, or how you shop for groceries, what each of us does matters. And we have to remember to give people some space, to keep our safe distance, to wear masks when we're in those indoor public spaces, to stay away from others if we're not feeling well, and to not have those gatherings where we can potentially pass this on to the people we are closest to. We need to stay apart, stay small, and stay local as we get through this next few weeks and make our way into spring. There are brighter days ahead, but we need to remember to be kind, to be calm, and to be safe